Hi, I'm Holly, and I'm going to go over 15 medical terms from Med Terminology. Chapter 6. Leukemia. When a person has a large number of abnormal or immature white blood cells, they have leukemia, which is a cancer of the white blood cells. Leukemia. Anemia. If someone has anemia, it means they have a reduction in the number of red blood cells, or the amount of hemoglobin in the blood, which causes them to have less oxygen reach within the tissues. Anemia. Hematoma. The medical term for the word bruise is a hematoma, which is just a collection of blood under the skin due to damaged blood vessels. Hematoma. Complete blood cell count, also known as CBC. When a patient's condition is unknown, a doctor can review their complete blood count, which can help reveal if there is an abnormal count of red blood cells, white blood cells, or hemoglobin. Complete blood count. Phlebotomy. When a patient needs to be tested for a certain disease, a healthcare provider uses phlebotomy to remove blood for a diagnostic test. Phlebotomy. Now on to Chapter 7. Chronic obstructive pulmonary disease, also known as COPD. It isn't uncommon for lifelong smokers to develop COPD, which is a chronic condition that diminishes lung capacity for inspiration and exhalation, making breathing more difficult than it should be. COPD. Sleep apnea. Sleep apnea is a scary condition to have because one's breathing stops repeatedly during sleep, long enough to produce a drop in oxygen levels. Sleep apnea. Chest X-ray. If a doctor is suspicious of something blocking the patient's airway, they will order a chest X-ray, which takes a radiographic picture of the lungs and heart from the back and the side. Chest X-ray. Endotracheal intubation. When a patient is put under for surgery, they receive an endotracheal intubation, which helps the patient breathe during the surgery by making a patent airway from the mouth all the way to the trachea. Endotracheal intubation. Rhinoplasty. When someone falls onto their face and breaks their nose, they will most likely receive a rhinoplasty, so their nose will be surgically repaired. Rhinoplasty. Now on to Chapter 8. Laxative. If someone is constipated, they are typically given a laxative to help them have a bowel movement. Laxative. Diarrhea. Someone who has GI disorders typically experiences diarrhea, which is frequent, liquid, and sometimes bloody bowel movements. Diarrhea. Dentures. It is common for older adults who didn't have good dental hygiene to get dentures, which is a partial or complete set of artificial teeth. Dentures. Cirrhosis. An alcoholic can develop cirrhosis, which is a chronic disease of the liver typically associated with liver failure. Psoriasis. Gastroenteritis. If someone's abdomen is larger than normal, that could be gastroenteritis, which means their stomach and small intestine is inflamed. Gastroenteritis. Thank you.